So you're turning 65 soon, and your mailbox is probably exploding with Medicare information. I get it, it's overwhelming. I'm Adrienne, a licensed Medicare agent, and I work with people every day who feel exactly like you're feeling right now. So, in the next 8 minutes, I'm going to break down all 4 parts of Medicare in a way that actually makes sense. No insurance jargon, no pressure, just straightforward answers. All right, so here's how Medicare breaks down. You've got 4 parts. Part A is hospital care. Part B is doctors and outpatient services. Part C, that's Medicare Advantage. It's offered by private companies instead of the government. And Part D handles your prescriptions. They all cost different amounts and have different rules. So let's dig into each one. Let's start with Part A, your hospital insurance. Part A covers hospital stays, skilled nursing facilities, and hospice care. Here's the good news. Most people don't pay a monthly premium for Part A because they've already paid for it through their payroll taxes while they were working. If you or your spouse worked at least 10 years, your Part A is free. Now, there is a deductible for Part A, but no monthly premium. Part B is what covers your doctor visits, outpatient care, lab tests, and medical equipment. Now, unlike Part A, Part B does come with a monthly premium. If you're already getting Social Security, they'll usually just deduct it from your check automatically. But if you're not getting Social Security yet, or you just prefer to pay it yourself, you can pay that too. Medicare will send you a bill. Once you meet your annual deductible, you'll typically pay about 20% when you use services. Here's what's important. You need to sign up for Part B during your enrollment period. If you're already receiving Social Security when you turn 65, they'll enroll you automatically. But if you miss your window and you don't have other credible coverage, you're looking at a late penalty. That pretty much sticks with you forever. So bottom line, Part B covers your everyday medical care. You pay a monthly premium for it, and you need to sign up on time to avoid penalties. All right, let's move on to Part C, Medicare Advantage. So this is a different option from private insurance companies. So instead of getting your benefits directly from the government like original Medicare, you're going through a private insurance company. So here's what makes it appealing to some people. Medicare Advantage plans have a low or even $0 premium. They often include extras like dental, vision, hearing, gym memberships. Sounds good, right? But here's the trade-off. You're working within a network. You need to use their approved doctors and hospitals. If you go outside the network, you could pay a lot more or get no coverage. So many services need prior authorization, which can be frustrating, which means you have to get approval before you get care. So bottom line, on Medicare Advantage, lower upfront costs, extra perks, but less freedom to see any doctor you want. What I usually ask my clients, which one is more important to you? Is it more important to you to have your teeth cleaned twice a year? Or is it more important to you to have the freedom to choose any doctor? That's the real question that you want to ask yourself. Now let's talk about Part D, your prescription drug coverage. If you have original Medicare, you need to buy a standalone Part D plan from a private insurance company. If you have a Medicare Advantage plan, drug coverage is usually already built into the plan. Part D premiums, they do vary a lot. Some plans cost nothing per month. Other plans can cost you over $100. Here's what matters. Don't just pick the cheapest plan. But also, don't assume the most expensive plan is the best either. More expensive plans don't always mean better coverage. I say that to people all the time. More expensive doesn't always mean better coverage. Every plan has what's called a formulary. That's the list of drugs they cover. A plan could cost you $100 a month and still not cover your specific medications. You want to compare plans based on the prescriptions you actually take, not the price tag. Good advice, right? But you'd be surprised how many people don't do this. So bottom line, Part D covers your prescriptions. The cost varies by plan, and you need to choose based on what you take, not what's cheapest or what's most expensive. So let me show you how this all comes together. You've got two main paths to choose from. Path 1, Original Medicare. That's Parts A and B together. You add a Part D drug plan and maybe get a supplement plan to cover the gaps. With this path, you can see any doctor who accepts Medicare. No networks, no referrals. Your costs are more predictable, but you're paying higher monthly premiums. Path 2, Medicare Advantage. This replaces Original Medicare entirely. It bundles everything together: hospital, doctors, and usually drugs. Lower premiums up front. You get extra benefits like dental and vision, but you're stuck in a network. You need to use their doctors and get prior authorization for certain services. So which one is better? Neither. It depends on what you value more, freedom or savings. So when do you actually sign up for all this? Well, your initial enrollment period is a 7-month window. It starts 3 months before the month you turn 65. It includes your birthday month, and it ends 3 months after. That gives you a full 7 months to get enrolled. Now here's what's critical. If you miss this window and you don't have other credible coverage from an employer, you're looking at late enrollment penalties. And these penalties, they don't go away. They stick with you for as long as you have Medicare. So don't skip the deadline. Bottom line, know your enrollment window and don't miss it unless you have employer coverage. Let's wrap this up with what you really need to remember. Part A covers hospital care and is usually free. Part B covers your doctors and outpatient care. You pay a monthly premium for that. Part C, Medicare Advantage, is your alternative if you want to go through a private insurance company. Part D covers your prescriptions. And remember, choose based on what you take, not the price tag. You have two paths: Original Medicare with the freedom to see any doctor, or Medicare Advantage with lower costs but network restrictions. Neither one is better. It depends on what matters more to you. And whatever you choose, do not miss your enrollment deadline. Those penalties are real and they're permanent. If this video helped you understand Medicare better, hit that subscribe button. I work in the Medicare space every day helping people navigate these exact decisions. So I created this channel to break down these topics for you. Clear, straightforward, no sales pitch. I post new videos every Tuesday and Friday with the information you need to make confident decisions about your healthcare. Thanks for watching, and I'll see you in the next one.